I think we've heard already today how important patient centricity, patient advocacy is. It's a powerful engine driving cell therapies forward. From law, regulatory issues, public support, funding, and education, it's clearly the patients, their friends, loved ones, and supporters, those with most of the skin in the game. And their supporters, they're the ones with the skin in the game through their narratives who are the main influencers. What's in their tool chest? How do advocates best wield their influence? What lessons can be learned, for example, from bone marrow donation, the first consumer advocacy success story in the world of cell therapies? So please welcome Dr. Randal Mills and Mr. Bernard Siegel, who's going to share some of their insights into patient advocacy. So Bernie, why don't we start with you? Tell us a little bit about your perspective, and you have also a personal story that's part of this, right?
Well, I do. This has been a journey for me. I've been 15 years a full-time stem cell advocate and advocate for regenerative medicine. 20 years ago, I was a patient with colon cancer. Very glad that's in my rearview mirror. But for many of you, you know, it's something like this. It's a wake-up call. And so it was a wake-up call for me. I was a practicing lawyer in Miami and used to come home from work happy that I sued someone. Now I'm on the side of angels. But the point being is that I was invited to attend the first International Society for Stem Cell Research meeting in Washington, D.C. back in 2003. And at that time, the world was dealing with cultural, religious norms and trying to decide on matters related to the legality and funding of embryonic stem cell research. I was very passionate about the field and was invited essentially to be the de facto lawyer for the scientist. I had many debates with some of the representatives of the Vatican, and I must think that they must have forgotten to Google me before they invited me here. But I'm very honored to be here, and over the years, I created a foundation now known as the Regenerative Medicine Foundation to accelerate regenerative medicine to improve health and deliver cures. We are agnostic as to the cells. We see the benefits of adult stem cell research and certainly understand the importance of collaboration. Along the way, I did the next logical step. I left the practice of law and became a full-time advocate, 501c3, went that route, and created an event, the World Stem Cell Summit. And that was and has turned into the ecosystem event for our field. We've had 15 annual meetings. The point of having that is, or the origins of that, is that the first ISSCR meeting, I was the only patient. And I learned that the scientists seemed only to speak in tongues. There was no one that could translate this, and I became a patient advocate. The thing I learned, though, the amazing thing, is that what I knew was my own ailments, the conditions, medical conditions impacting my family. I was a lawyer, not a doctor, right? So when I started to interact with the patients, what I learned is that if you had diabetes, you just didn't take an injection of insulin. That wasn't the beginning and the end. And if you had Parkinson's, you didn't take some medicine to stop the tremors. And being a lawyer, you end up feeling like you represent the field. And that's how I felt as I got into this. And what I learned is there was an ecosystem, there are fault lines right below that are societal fault lines. If you went to the last ISSCR meeting, you know what you would have found? A discussion on mini brains. And they said it's not ethically neutral, that maybe these brains, little mini brains, could feel pain, and we need to have a similar type conference about this. Can you imagine? These are just a few of the issues that we are facing today. There are safety issues. Where does the law stand on that? Where are we going to go with distributive justice? How can all of these tremendous technologies that we're dealing with in this meeting not only go to those that only want to live forever and have the resources and think they'll never run out of money, but how about all the parts of the world in need? You know, I salute the Vatican for leading the way on this, and that'll be the big advocacy issue of the future.
Great, thank you, Bernie. And I'm still trying to wrap my head around the little mini brain that you were talking about there. I'm trying to picture that somehow. But let me bring you back.
He was talking about mine.
I didn't want to say that. But let me bring you back to patient advocacy, if I can. A lot of the patient advocacy that we heard so far today is really about patients pushing for more research, primarily. But there are different versions, if you will, of patient advocacy. Where do you see this, for example, in regulatory issues? Is that an important area where patients can and should get involved?
One of the reasons I became involved, because I realized we're going to cure a mouse of diabetes with stem cells one day, and it could take 20 years and $2 billion. That's unacceptable, isn't it? So, of course, we have a rich history in the United States of patient advocacy. I think of Mary Lasker and the American Cancer Society, the polio epidemic, when a whole generation of children were presented themselves for essentially a clinical trial, AIDS, HIV, breast cancer to get the proper allocation for women's health issues, and we all wear a pink ribbon. The battle for the California Institute for Regenerative Medicine that Dr. Mills led. All of these things represent patients coming together, whether it's parochial for their own family's interest, they're competing, fighting for NIH funding, for research funding, or uniting together to address some of the regulatory hurdles, the societal hurdles, to try to move this field forward. And the way we do it, of course, is organize ourselves, have dialogues like this, and understand that there are more things that we have in common as a goal than what separates us.
So patient advocacy is actually a big tent.
It's a big tent, and I do believe it's the engine that drives everything forward. Sometimes industry might forget it, but patients aren't just tools to be brought out. We are the voice that really drives everything forward. We have been, and certainly in the 20th century, and I think even more challenges in this century.
Thank you, Bernie. And, we mentioned before, Randy, that bone marrow transplantation, bone marrow donation is really one of the success stories here. Tell me a little bit more about that, and I take it we have more work to do.
We do have more work to do, and let me take you through a little bit about how bone marrow transplantation actually happens. So I have the honor and privilege of leading an organization called Be the Match, or the National Marrow Donor Program. This is the organization that was designed to take serendipity out of transplantation. So you didn't need to have an identical twin. You didn't need to have a brother or sister that happened to match. The idea was that this organization was going to have unrelated people join a registry and be willing to donate their bone marrow to someone they didn't know in order to save their life from diseases like leukemia and lymphoma and certain genetic diseases. And the organization has done a phenomenal job. It's been 30 years in the making, and the organization has grown. It's the largest registry in the world. We deliver over 6,000 transplants a year. To do those 6,000, we work up 78,000 different donors to find 6,000 that actually match. There's an army of 1,200 professionals at Be the Match that do this work, but they're backed up by another 7,000 volunteers, talk about advocacy, flying these bone marrow all around the world. We also operate an outcomes registry, so it's not enough for us just to be able to provide the bone marrow to the patients that need it, but we want to make sure that they have good outcomes, and so we follow them. We collect all of the data on every bone marrow transplant that's done, and then we also have a foundation, a philanthropic foundation, that enables us to provide patient assistance for those patients where there are economic barriers to transplant. And so this is why this organization was created. It was created for this vision, so that a match is available for everyone in need. And that is a beautiful picture. It's a beautiful picture to think that if one of our sons or daughters, brothers or sisters, or husbands or wives need a match, there's a match there waiting for you when you need it. And you look at this picture, and I'm going to tell you it's not true. This picture is far from complete. So the key to this picture is if you look at their jersey numbers are their likelihood of us being able to provide them a match. And so for a Caucasian, we have 75% or better likelihood of being able to find you a match. If you're Hispanic or Asian descent, that number drops off below 50%. And if you're African American, the number is 18%. So this has to get fixed, and we need help to do that. So unrelated transplant, like I'm describing, while available to about 110 million Americans, or about 1/3 of the population, is not an option for about 2/3 of the population, for a few reasons, and a few reasons that you can help with today, and that's really why we're very excited to be here. So first off the bat, 36% of the people that come and look for a match on our registry, 36% of the people, we are unable to find one. We do a search that goes through 34 million potential people, and 36% of the time we don't have anyone on the registry that matches them. But it's not even, as I said. So if the person seeking the match is African American, 70% of the time we don't have a match for them on the registry. That's it. That's where it stops. And this problem is a problem for us, actually kind of a beautiful thing that's happening in the country. The country's becoming more diverse. As the country becomes more diverse, though, it becomes more difficult for us to find matches for people. And so we went back and we looked just last year at all of the people that we added to the registry, and it was kind of remarkable. 48% of the people overall that we added to the registry, we had not seen their HLA type, their match type before on our registry, including all the way up to 78% of Black Americans that joined the registry. We have never seen their HLA type before. So the country is becoming more unique, and we need to race to keep up with that. And you can see this too, just sort of interesting, if we look at our ability to match people by decade of life. Most people don't know this, but bone marrow transplant primarily done in people 60 years or older. That's because the main indication for bone marrow transplant, acute myelogenous leukemia, or AML, has a median age of onset of 61. We're able to match those people actually pretty well. 54% of the time we can find a match. Every decade of life younger than that, though, so the newer you are to this world, the more or the less likely it is that we can find a match for you. There's also a willingness to donate. So half of the people on our registry that join and say, hey, if you need my bone marrow, I'll donate. Half of the time, when called, they say, never mind. Half the time, they say, never mind. And again, there's disparity there too. So 36% of white Americans decline donation when called, 72% of African Americans decline donation. So that takes that problem that started with, we have very low minority representation on the registry, and then only 1 out of 4 of them actually say yes when called, makes a bad problem much, much worse, because oftentimes they're the only potential donor on the registry. This disparity has a face. It's real. So this happens, we unfortunately get 13,000 requests each year. We're able to provide about 6,000 donations as a result of it, of bone marrow as a result of it. And this is one of them. This is Thor. So Thor is a 7-year-old. Thor won my heart over when he said he wanted to be a pilot. I'm a pilot, I love to fly, and Thor is going to be a pilot. Unfortunately, Thor has very, very severe sickle cell disease, and so he is frequently in the emergency room. He has chronic issues with being able to breathe and an incredible amount of pain, and he needs a bone marrow transplant to do that. Thor's physician came to us and said, we need a bone marrow match for Thor, and we said, good news, we have them, let's give them a call, and they said no, and we only had one. So now, Thor and his family wait. This is what it takes to join the registry: a cheek swab. Put a swab in your mouth, put it back in this kit, mail it back to us, and we take care of the rest. It is simple, it is fast, it is painless, it is free, and it can save a life. So our vision, our goal at Be the Match is to democratize cell therapy. That means a cell therapy for everyone that needs it, irrespective of racial or socioeconomic backgrounds. Now, there are far other issues in order to realize this than just being able to find a match, but what we're talking about here today is finding a match. So what can you do? Join the registry. We're specifically looking for people between the ages of 18 to 45 years old to join the match. If you know somebody, tell them to join the registry. If they do join the registry, encourage them to donate when called. Donate your cord blood to a public bank, particularly people of underrepresented populations. And if you can't do any of those things, at least consider donating to the foundation so that patients can have access to this. This is something that can be done. We've seen success stories with this. So there's a University of Colorado football program. Coach McIntyre decided he was going to make this a cause, and he said, I'm going to tell my players, I want them to donate. But I want them to think about joining the registry. He didn't require them to join the registry, he just made them aware of it. Why? Because he looked around their locker room and he saw a locker room that looked a lot like this audience. It was very, very diverse. And Coach McIntyre's, the team is only about 88 people on a football team. Coach McIntyre has had 8 of his players donate, and he has another 2 that are being worked up. Robin Roberts, same thing. After her bone marrow transplant, she decided she was going to make it a mission to get people to join the registry. She went out, talked about it. 18,000 people joined the registry. 173 people got transplanted as a direct result of what Robin Roberts was able to do. So I am asking you, I am begging you to please jump on this bandwagon and help us. This is a stem cell therapy for the here and now, and you can make a difference, and it doesn't cost anything, and there is no ethical issue over it. So please, if you would, consider helping us be the match.
Thank you, Randy. So you've identified 2 big problems there. One is we need more people, more from unique populations to be matched, to donate, to be matched but not yet donate. And you told us how we hopefully can improve on that.
Yes.
How do we improve on the conversion rate, if you will, when someone is asked and they go, yeah, you know what, never mind? Yeah,
so there is a lot of stereotype around peripheral blood and bone marrow transplant, and particularly the donation process. And we need to continue to work through that. So very frequently it's represented as an incredibly painful procedure. It's not. There are multiple ways to donate, some that don't involve going into the bone marrow compartment at all. And so we need to tackle that, but we also need to be out in the community more. We need, internally, we have a saying called be there. We need to be in the communities that we serve, and we need to be reflective of the communities that we serve. And there are registries that are doing a great job helping us with that. We need more of them.
And Bernie, we've talked about this as Randy was saying, this is stem cell therapy for the here and now. But a lot of what you deal with in the stem cell summits and these stem cell conferences are future medicine, right? Sure. So how can advocacy help with that when it's still sort of slightly almost science fiction-y to a lot of people? Is that just education, or how does patient advocacy fit in that?
Well, certainly education is really important. Abraham Lincoln said, with public appreciation, you can do anything. Without it, you can't get anything done. So part of it is education, understanding we live in a Toffler-esque world, future shock world, right? These technologies are coming upon us so quickly, and surprisingly, shockingly, drawing these boundaries, we've barely started as a society to draw the proper boundaries as to what we should do, what we can do, and what we can't do. And without education, it is really this is a species-altering event. Make no mistake, and it's accelerating faster than we can keep in our line of sight. So one of the things that we try to do, we have public advocacy days, we online seminars, a regenerative medicine essentials course that we do with Wake Forest Institute for Regenerative Medicine. And it's not only just patients, it's clinicians, because the clinicians are right there, most of them very honorable, wanting to help their patients, not taking advantage of things. But there are clinics that maybe are, as Dr. Gottlieb has referred to, bad actors. And how much influence do they have? Who are the good guys that we should support? So all of these great societal issues are right in the here and now. It's a big challenge and something that we all have to work on together.
So it sounds like to me, education and communication is going to be a big help.
It is indeed.
For both of us.
Over
right?
communication.
Very good. Thank you, Randy. Thank you, Bernie. Thank you all. go get your cheek swabbed.